One thing that I really like doing is adding input to the body while we laser a certain part of the head. So if we start with, let's go left cerebellum. Let's come around here. So if we start with left cerebellum, which is right behind the left ear here, we want to be able to give input to the body that correlates with that part of the brain. So a couple things that we can do, even starting without vibration, we could just give some small little movements to that arm. The cerebellum more so likes complex movements. What that essentially means is a non-linear movement. So we could go with the arm, we could go down through the wrist, we could go through all the fingers and do figure eights with all the different limbs. So if we've identified that the left cerebellum needs some work, that's definitely an area that we can work on. We could do the arm, we could do the same exact concept with the leg here. So figure eight with the hip, figure eight with the ankle, figure eights with the toes. From there, from an outside the movement perspective, we could also work on the primitive reflexes on the same side as well. So we have different things with the hand, so we could vibrate in the hand, we could go between the fingers, we can go on the cheeks, we can go on the bottom of the foot, and these are all reflexes that will ultimately integrate on the same side brainstem, and that's why we laser the cerebellum here. And then after that, working upstream, we could then go over to the opposite side cortex. So let's go up to right brain. So with this, we can do some of our stretching, we could do some of our gross motor movements where we could work up and down. We can go up and down with the leg here, so these are your linear movements, so different stretching. Or we could even add something like vibration, whatever that might be, just up and down the arms, up and down the legs, because we know all the vibration, just gross vibration, is going to cross over to the opposite side parietal lobe.